So eating disorders are basically, disorders where people either eat much more than what is necessary, or they don't eat at all, because of which they lose a lot of weight, or they eat in fits and starts. So why are they called mental health problems rather than eating problems? I think one of the reasons is because the classical eating disorder, which is called anorexia nervosa, is a condition where people, where usually occurs in women and young people, and they don't eat very well, so much so that they lose a lot of weight, and they lose weight below a cutoff. Their BMI is very low, their body mass index is very low. They suffer nutritional deficiencies, and all of this is related primarily to their body image. So they feel that they are fat, they have immense fear of fatness, and to get over this fear and to stay thin, they don't eat at all, and they do a lot of other behaviors which will keep them thin. So I think the reason why eating disorders like anorexia are considered mental health disorders is because the issue is not so much only about food, but the way they think about food, the way they feel about food, and the way they feel about their own body image in the context of food. And the similar profile happens in what is called bulimia nervosa, where again you'll find people eating a lot in fits and starts. Quite often it's related to their mood. So it starts off with comfort eating and eating when they are low, but after some time they just lose control over their eating patterns. And again, it's associated with body image disturbances. So while on the one hand they eat a lot, they also continue to want to be very thin and perceive themselves as overweight. So I think it's because there is this whole relationship between the way they think, they feel, and they behave towards food, that eating disorders are considered a mental health problem. Adolescence is the time where eating disorders usually begin. So, around the age of 12 or 13, when body image issues are in the forefront. Though no age is actually exempt from eating disorders, except maybe after the age of 40, you would rarely find it. But you may get eating disorders even in the 20s or 30s, but it's much more common in the teenage group, and of course it's much more common in girls compared to boys, though there are lots of cases now of young men also developing eating disorders, but in terms of proportion it's much higher in girls than in boys. However, boys who are, let's say, jockeys or models or stewards, where you need who work in airlines, who need to maintain weight at a particular level or at a low level, are again at risk for developing either bulimia or anorexia. So they're not exempt from it, but it's much more common in girls, probably because body image issues are more common in girls. Even among women, I think there are some professions where the risks are higher than the others, though it's not that only they have the problem. So, for example, film stars, models, ballet dancers, these are the professions where you'll find that these conditions are, eating disorders generally are higher. So the early signs are usually that, if you find that a young girl is dieting excessively, and is very secretive about food, does not want to eat in the company of everybody else, or even if she starts eating, she will eat very less or cuts her food in pieces, are very particular about what she's eating. I mean, there is of course a difference between normal dieting and extreme dieting. So in a girl with anorexia nervosa, the dieting can be quite extreme, and that might be one of the reasons why they're so secretive about food. That's one thing. And the second thing is that if somebody is losing weight drastically, you find that the person is eating okay but is losing a lot of weight. Of course, you need to think of a lot of medical reasons why somebody is losing weight, like various medical disorders. But if all those are ruled out and the person is eating properly and is still losing weight, you need to think of a eating disorder. The third issue is that if somebody is eating and then suddenly leaves the dining table, and you suspect that the person may be purging or inducing vomiting to get over the impact of the food, then that's another another concern and a sort of it might flag that there may be some problem. But quite often it's very difficult to make out because most young people diet. Most young people are very particular about their weight, and so oftentimes we feel that it may be something very normal and it may be just related to the age and preoccupation with body image. But I think one needs to be careful if you find that any of these things are happening. If there is excessive eating, for example, if somebody is feeling low and then tends to eat a lot, again, you might want to think that maybe these are very early signs. The person may not have an eating disorder yet, but then these may be red flags for an eating disorder. It's very difficult to approach this issue with, if you suspect an eating disorder, because usually they completely deny it, and they would say that they're just doing normal dieting like what everybody else is doing, or they would say that it's they want to look slim, and they don't want to. They feel they're fat. They're very secretive about what they eat. So quite often you might find people, young people actually denying it and not accepting that they have a problem. They may say, yes, I'm dieting excessively, but may not perceive it as an eating disorder. So caregivers or family members have to be approach it quite sensitively. Initially, you might approach it in a medical model, say that it because you're not eating very well, you're losing so much weight, you might be developing nutritional deficiencies. So let's go see a general physician or a pediatrician to check out if you have any problems, so that the person doesn't feel very threatened. Usually eating disorders require outpatient treatment, unless, of course, in anorexia nervosa, if somebody is very emaciated and there are a lot of medical complications, then ideally they should be in a setup where a good medical management physician is available, as well as a psychiatrist and a psychologist. So that's the usual place. So it's a multidisciplinary approach, a team approach. Um, a lot of the time is spent on nutritional counseling for people with both anorexia and bulimia, and in addition to that, the kind of therapy which is useful is usually the cognitive behavior therapy, though you can have other forms of psychotherapy also. They respond best, like I mentioned earlier, to a combination of psychotherapy and medication rather than to medication alone. But nutritional counseling probably is one of the key elements of managing somebody with an eating disorder. So, like I mentioned, you have the anorexia nervosa, then there is the bulimia nervosa, and the binge eating disorder. So, the bulimia nervosa is probably the best prognosis. They recover better, and because it's not such a harmful condition, probably in terms of recovery and outcome, it is better. It also responds better to medications. So certain antidepressants are used in the treatment, and it responds well to cognitive behavior therapy and a combination of cognitive behavior therapy, which is a form of psychological therapy, and family therapy as well. However, anorexia nervosa, if it is a classical anorexia nervosa, quite often we find that the cases are more atypical. They don't have all the signs that are described, and these we call as atypical eating disorders, or what is called EDNOS, eating disorders not otherwise specified. But anorexia nervosa has a poorer course because the nutritional deficiencies are quite severe. In bulimia, the complications may be because of vomiting. So, if a person is vomiting a lot, then they may have gastritis, there may be a gastric bleed, there may be problems in the oral area. But with anorexia, it's more, marked nutritional deficiencies. A woman may actually stop having her periods, or if she's in the age of puberty, may have a delayed puberty or menarche, and the bones get brittle because obviously there are hormonal disturbances as well. So recovery is a little more guarded in anorexia, slightly better in bulimia, but all of them tend to go through a yo-yoing course. So you'll get, they may improve for some time, and then again there is a slip, again they improve for some time, again there is a slip. So one can expect that kind of a course in people with eating disorders. For a long time, it was considered, in fact, a culture bound syndrome, that it is much more in Western cultures than in the Indian cultures. And 10 years back, we would it was rare, it was a rare condition. But off late, with westernization, with a lot of stress that the young people go through, one finds that the rates are increasing. It's still not as much as in the West, but in most Asian countries, particularly the Asian countries where there's more westernization, for example, Hong Kong, Singapore, actually there has been an increase in eating disorders. In India, it's not as much, but it's definitely increasing. And we find that the girls who get eating disorders are also have sort of models of film stars and want to be like a certain person. So there is a lot of body image issues which are involved. There is the role of media and the role of fashion icons in sort of creating this whole idea that you are perfect if you are very, very thin, and all of that. Having said that, though the problem starts off as an extreme dieting and a body image disorder, after a while it just has its own life, and it's no longer connected to being like somebody. It's about control. It's about dealing with their problems and their emotions through eating or not eating. So even though it might start off as something which is much more body image related, or influenced by media or popular icons, after that, after a while it just takes on a life of its own and becomes a very sort of more serious disorder.